So in our previous class, we learned that prevention. Apart from the prevention, once this tuberculosis has occurred, then we have to use the anti-tubercular drugs or the therapy, which can resistance, which can prevent this disease. So the response of microbacterial infections to chemotherapy is slow. Treatment must be administered for months to years, depending on which drugs are used. So the classifications are according to their clinical utility. The anti-tubercular drugs can be divided into first line and second line. So first line, these drugs have high tubercular efficacy as well as low toxicity, are used routinely. So the first line drugs which have anti-tubercular efficacy, is high and toxicity is low, which uh, which is used routinely. The names of the first line drugs are isoniazid, rifampin, pyrazinamide, ethambutol, streptomycin, etc. And second line drugs, these drugs have either a low antitubercular efficacy or a high toxicity or both, that are used in special circumstances only. So first line drugs which have high antitubercular efficacy and a low toxicity, but in case of second line drugs, antitubercular drugs which have low antitubercular efficacy or high toxicity, or consisting both low antitubercular efficacy and high toxicity. So the names in second line drugs that are thiacetazone, para-aminosalicylic acid or PAS, ethionamide, cycloserine, kanamycin, amikacin. And nowadays, the newer drugs which are used in case of antitubercular tuberculosis, like ciprofloxacins, these are under the fluoroquinolones. Fluoroquinolones, the newer macrolides, and some rifampin congeners are recently addition to the antimicrobacterial drugs. According to their clinical utility, the anti-tubercular drugs can be divided into first line and second line. So for the newer drugs, there are some drugs which are added to these second line drugs for anti-tubercular efficacy, like ciprofloxacin, ofloxacin, clarithromycin. Ciprofloxacin and ofloxacin, these are the macrolides. These are under these are under fluoroquinolones, and clarithromycin, azithromycin, these are under macrolides. So here the second line drugs which have low antitubercular efficacy or high toxicity, like para-aminosalicylic acid, that means the PAS, cycloserine, kanamycin, amikacin, ciprofloxacin, ofloxacin, clarithromycin, and azithromycin. So tuberculosis most commonly affects the lungs. Previously, I have told you. From the next class, we will read this mechanism of all first-line tubercular drugs, like the mode of action, how they work against Mycobacterium tuberculosis. Okay.